Hi, sweeties. How are you doing? Welcome to Naya Sim, and thank you all so much for all the love and support. Hope you all are doing great. Today, we'll be talking something very important, and it's about a nurse exposing some certain things that she has seen being a nurse that happens to people that look like me, that doctors ignore and do not want to attend to people that look like me because they always think that we are overreacting or we are like we are exaggerating how we feel, what we feel, And she was like, she started like, that black women are systematically ignored and dismissed without detrimental outcomes, including death and under treatment for pain and all of that. And like why she was saying all that, I am like, my brain was spinning, and I am like, how do I convince somebody, or how do you have to prove some, like, how hard you have to work to prove to somebody that you are telling somebody that you are in pain, and they are insisting that you are not in pain, or that you actually cannot, like they ask it, like it's just like one lady that said that she had eye test, but she didn't pass the eye test, and then she wanted, like the father was like, I mean, we have to scan to check if there is something wrong with my daughter and all that. The man started making a scene. That was how they tried checking to find out that the girl was bleeding in the brain. What if the father did not argue? Let's get.
Black women face systematic dismissal in the healthcare setting, leading to adverse outcomes for them. And this is discussed in many journals of medicine, and it's something that I have to talk about. It is something that may get a little bit of pushback. I don't freaking care. It's the right thing to do to highlight this inhumane way of treating another human being based on race or gender. Black women are twice as likely to die as white women in childbirth. Why would that be? It's not physiological. Statistically speaking, they are up to 30% less likely to receive pain management in the emergency room for things like abdominal pain. When I think back on my career, I have a couple of instances where I saw this kind of treatment of black women in the emergency room, and I heard it in their voices over the phone, and it haunts me. The thing that I feel good about is on the phone as an advice nurse, if I heard that I was speaking to a black woman, I knew that I had to be very patient and listen. And especially if they were very upset and maybe even demanding in the beginning of the call, I know that panic of I need you to hear me was what I was witnessing, and I needed to respect that and effing listen. And 9.9 times out of 10 on these calls, at the end of the call, I got a lot of positive feedback and gratefulness for thanking me for freaking listening to the symptoms and asking the right questions and not dismissing or blowing off their concerns, their pain, their need for treatment, their need to be heard, etc. In the emergency room, I have a specific instance of a large and loud black woman coming in. Her initial, chief complaint, I can't remember exactly what it was. It may have had something to do with respiratory distress. Anyway, she was put into a back room. Doctor came in. She was very loud. She was very demanding. She had a lot of complaints, and he was like, I could just see him putting up the wall already. He left, and I did what I was supposed to do and sort of taking care of her. I checked on her about 10-15 minutes later, and she was in severe respiratory distress, very loud respiratory distress. So I went back to the doctor to give him an update. As soon as I mentioned her name, he went like this, like, don't talk to me. My reaction to this day to that kind of, not only response to a nurse who's trying to update you on the events of a patient, but for that patient, I have a visceral reaction, and I know violence is bad, but my reaction is I just want to, we'll go there. But I didn't back down. I got his attention, and she went on CPAP, which is a machine that helps you breathe. It forces you to breathe. Maybe it was BiPAP. I don't remember right now. Why the cultural disparity and what can we do about it? First of all, for all you healthcare workers out there, you have to look at your implicit bias. And I know this is for all cultures. Like, I'm not trying to dismiss any other cultural difficulties in exchange in healthcare. I mean, this topic can be applied to all the different races, especially when you're dealing with, Caucasian healthcare workers dealing with anybody else's culture that they're not familiar with. I mean, that's an issue. But specifically today about Black women, because I feel like their case is special. If you just think about a Black woman yourself, no matter who you are, what is the first thing you think of? The first thing I think of is strong. Now, that's just me. I'm not speaking for any of you, but could it possibly be that we see women like this and we think that they can handle it, therefore they should? Because that's bullshit. How about this? If you have a personality that's very loud and demanding, does that mean that they're overacting or overreacting and therefore you should undertreat them because you think they're overreacting because they're being loud and demanding? If you were systematically dismissed, don't you think you would get louder and louder and more demanding to make sure that your needs were being met? I'm Katie, recently retired nurse. Yes, this is just for show. Please give me a follow. Daily, I highlight symptoms of concern. I explain pathophysiology to help you understand your body better. And today, I'm bringing up a topic about injustice in the healthcare setting. If you're a healthcare worker, check yourself. Do you carry inherent bias? If somebody is loud and demanding, no matter what their race, do you put up a wall that prevents you from giving them appropriate care? I have another memory of, and this was a young man, came into the emergency room with a severe migraine, and he was African American, and he was literally falling all over the room and laying on the floor and, pounding things and kicking his legs, and he was in so much pain he was going out of his mind. And I just knew that when the doctor came in and saw that behavior, that they would dismiss it as overreacting or overacting. And so I had a quiet conversation. I probably shouldn't have done this, but I did it anyway, with him and his mom, to let him know that I could see that he's in a lot of pain, but my worry was that the doctor wouldn't take it seriously, and if he could just express his pain by laying in the bed and, speaking the words instead of falling all over the room and making a lot of noise. And I had to advocate for that patient quite a bit to get him more and more pain medication because of, again, I feel at that moment there was this inherent bias that he was overacting, even though he had toned it down quite a bit. Bottom line, please send this to a healthcare worker if you feel like they need to highlight this issue in their own practice and just be more aware. Humanity as a whole, we have got to move past these inherent biases and learn how to take care of one another, no matter the modus of communication or the color of one's skin or any inherent thoughts about whether they can or cannot handle the effing pain. I would love to hear your thoughts and your comments on this. Share your story.
So I am going to start by saying that may we not be a victim of going through pain. When you are really going through pain and you are trying to express how you are going through pain, or you cannot also express how you are in pain, and people, especially someone that is supposed to listen to you, check you up and do the needful, it's saying that you are overreacting. I mean, this really had to be one of the saddest things, somebody really have to listen to, because I know, okay, how sometimes I am in pain. I am in serious pain, especially being a woman, and you are going through it, right? And you are telling people how you are in so much pain. And somebody's asking you, are you really sure that you are in pain? Or having to tell you that you are probably overdosed, or you are probably high on something, just because of your skin color, right? And some people, sincerely speaking, some people are not supposed to be health workers. They are not even supposed to smell anything that got to do with health, because I know so many of them have biases. There are some words I really do not want to use. I am trying to, be kind, not really be kind, just because of the algorithm and all that, you know. And really, I am trying to wrap my head around like all these things she has said. And the fact that I have seen a lot of people say so many things about their experience, especially Black people. And like when you go to her comment section, all you are going to see are Black people telling their experiences, what they have done. And she has herself also, she has experience in being a nurse and being around those doctors all the time, being around people that look like me all the time, what they go through, when they come in and they are going through so much pain. But nobody wants to accept, nobody wants to believe that they are going through that, because of course you are a Black person and you are not supposed to go through pain. And I have seen so many people die because of that. Why? Because they did not administer, or because they did not give what they are supposed to give to the person, or because they did not check the person up. I remember one of them said I was accused out, and they said she was faking it, and she failed an eye test, and they just like the father kind of demanded that they do a scan on her head and all that, and they called the security on them, and then the father probably started making a scene. And they decided to probably they took them back, right? And then went back to scan the young lady, just to find out that she was bleeding in her brain. So what if her father did not start struggling? What if there was no struggling? What if it is something that, yeah, you are good, you do not have anything, and they decided to go back? And probably that is how that person would just like that. Medical negligence, And a lot of people, not just only her. One was also saying that her daughter was pronounced brain dead after the ambulance services decided that she was not priority, because they always have priority, right? And what did she do? She started seeking for assistance, looking for people to take her daughter to the hospital, and looking for. And the fact that some of all these things happen to people that are nurses, you can imagine being a nurse, probably a Black nurse, right? And you cannot save your own child. You are watching your child go through so many things, and you couldn't help because they have biases. And you also being a health worker couldn't also even save you. It is really terrible, and something needs to be done about it. Really, being Black is just a huge work. When I say a huge work, a very huge work on its own. Because can you imagine people not believing that you are going through pain, or people not believing that you cannot walk, right? Just because you are Black, and because they do not expect you to go through pain, or because they say you are just overreacting, because who always overreacts? We are always overreacting. May heaven help us. See you all in my next video. Bye for now.